right? You do not have to enroll in a Medicare Advantage plan. To answer the man's question in the back, I'm not sure I've answered whether you want a Medicare Advantage plan or not. Some people still, I mean, there are some people who like them and they work for them, but you have to know what you're buying. Medicare Advantage is not right for everyone. Take your time, look at the options that are available. Medicare wants us to talk about identity theft because identity theft doesn't have a day or a year or a time frame. Identity theft happens every day to somebody. Keep your Social Security card close. Keep your license close. Don't be sharing anything over the phone. Please don't share anything over the phone, okay? Now, there are some times when doctor's offices or so on have to double check some things with you. That's a different story. I'm not talking about that, okay? If you find some people who aren't doing the things correctly, 1-800-MEDICARE, okay? We want those people off the street. Medicare health plans and drug plans, you can change something each year. You need to look at it each year. It may only be 5 minutes. Or it may be you need the afternoon on a Sunday with a cup of coffee and a newspaper, okay? But you need to look at it. That's what's important. If you have not downloaded or printed a Medicare and You book for 2019, go to Medicare.gov and you can do that. It's right there. I'll warn you before you print it, it's a couple hundred pages. So you want to be careful. Some additional resources. 1-800-MEDICARE I've been talking about. Medicare.gov we just looked at. Locally, Illinois SHIP. And I believe, there's some local people who work with this here in town. Do you remember, Aaron brought that up yesterday and I didn't write it down.
It might be the senior center.
It might be the senior center, okay. So they're there to help you. They have information, they'll help you walk through this. You get a letter and you have no idea what the letter is really telling you, they'll help you. You also have TRICARE for Life, if you're a part of the Veterans Administration, Federal Health Benefit Program, Railroad Retirement. So these are all the numbers you can have at your fingertips. Now, I get some grief every time, so I always talk about this. This is not ARP United. This is ARP, the separate arm that is a Medicare specialty call, and they do a good job of talking about Medicare. They're not going to shift you. They're not going to sell you. They're like me. They're an education person. Okay? So that's why that hotline is up there. And for those of you who just love Facebook, if you want to follow Medicare on Facebook, go ahead. I'm sure they'd love to have your like or your loves. That's it. Questions? Anything I can go back over? I put you all to sleep.
I think in a later slide, like you answered my question, but so at 65 you're still working and you're not self-employed like we are, and you're an employee. But your employer say you have to pay 30%, which is a lot higher
than the 300.
So you can opt out of that, but you just can't ever get back in it. When
Correct.
You do it. You're just
Correct.
You're just with Medicare.
Yeah, let me repeat that in case you didn't hear it. When you're turning 65 and you work for a small employer, okay, then that's when you leave that small employer plan and you join Medicare. You pay the Part B premium and you choose whether you want a supplement or Medicare Advantage, because it's going to be less costly for you than staying in a group plan, okay? But again, larger employers, you're working for somebody who has 50 to 100 or 200 or 500 employees, that's the different story. That's when you have the option to say, no, I'm going to stay on my group plan rather than entering Medicare. Okay? Yes?
Ask you how the mechanics work. I'll give you my birthday's March the 7th. I'll be 65.
Okay.
So I can start after December the 7th to sign up for Medicare, is that correct?
No, 3 months before. So you said March, so yes, January. You can start looking now.
Okay.
Blue Cross would actually take your application today.
Okay.
They're the only company that will.
Okay.
Okay? But you can look at what you want to do, and it's all...
You enroll, excuse me, you enroll the Medicare first before you
Yes.
do the supplements?
Yes, you have to enroll in Medicare Parts A and B, so they should be sending you a letter within the next 35 to 40 days.
Okay,
Okay, and that letter is going to say, here's your bill for $135.
Okay.
This is not a bill, but you're going to be getting one.
okay,
Okay, and that's your option then to opt out, to say, no, I don't want to be in this because I have my group plan.
okay,
Okay, you send that back to them, you're done.
okay,
Okay, then later on when you fully retire, then you have to contact Social Security and sign up for Part B. Okay, so yes, you want to do you want to do Social Security first, then look at plans. Okay, and you can do Social Security online, or you can go to the ssa.gov, ssa.gov, not com again. Okay, or you can go to Terre Haute or
Danville.
Danville. Yeah. Okay.
We found Terre Haute to be a lot better. I'm sorry, I didn't mean to be mean. Once you sign up for Medicare and you're waiting for your card,
Uh-huh.
is there a way to get your number, that number on that card, so you can go ahead and sign up? We're waiting for our card so we can sign up for something.
You can call back to the Social Security Administration. They're supposed to, if you go to ssa.gov again, there's supposed to be a way that you can set up your portal, put in your information, and print a sample. If not, you can call the Social Security office, and they are supposed to give you a sample, or at least give you the number.
What is that?
Yeah, I appreciate that. I can't do the customer service for them.
We're just kind of in the waiting,
Yeah.
we're playing the waiting game.
Yeah, and I appreciate that. That's, you know, from a 6-month window standpoint, the sooner you sign up, you know, that helps, but it doesn't always make it.
Gotten different information from different social security,
Oh, lovely. Okay.
which is not helpful.
No.
But Terre Haute has been wonderful.
Okay.
So,
Yes.
Okay, what if you were on disability when you were like 57, and you've been carrying Part B yourself,
Mhm.
but then when you turn 65, do you just keep that Part B, or do you have to pay for it a different kind of?
No. If
You won't be punished,
No.
you've already got it.
Correct. If you've had that Part D before you turn 65, and again, they don't send you a letter saying their formulary is changing or they're making some other changes, and you like it, price is right, then you keep it. Yes. Okay, that's a great question. I hadn't had that one before. Okay, thank you.
Appointment, I gotta go. Thank
No
you very
problem.
much.
Appreciate your time. Any other questions?
Well, the main reason I'm here is because I don't know if I'm paying more than I should have to.
Mhm.
Because I've had the same thing for several years, and I don't really know how to get in contact with companies. I don't know the names of them or anything to find out if
Okay.
it's cheaper.
We'll
I have
talk.
F, and I did hear you say the F is good.
Yeah.
Just keep it. So I do have F, and I have a drug plan.
Mhm.
You know, that's separate.
Right.
Should I go to one that has the drug plan with it?
Let's talk after we're done. Okay. There's a couple of people I can sort you to, but okay.
Here, you were gracious enough to write the Medicare Advantage Plan screen, so those of us ignorant people who have Medicare Advantage currently. Don't ask me why they did it, but my parents did, so now
Okay.
that's what I'm looking at to get out of for them. But, what about the 10 basic plans that have higher deductibles? The only way to find those is actually through the Medicare.gov website?
The Medicare and You booklet is the best way, yes. So you go, this is the screen she was talking about,
Yeah,
okay?
that's the one that I said that.
Right, that's the screen. Those are the new premiums and everything for 2019, okay? So what you can do, okay, here, and I believe it's under Forms, Help, and Resources. You can download the 2019 and Me, or You, Medicare booklet, number one, okay? Number two, the slide in here, long ways back. There's a slide in here that shows you all the plans for Medicare itself. Doesn't show you the pricing because it depends on the age, but it shows you the plans. F and G are the two most popular.
No, I meant company. That's what
Right.
I'm sorry.
Yeah, there's 40 companies, so I can't list all 40 companies, okay? Yeah, I apologize. Yeah, can't do that, unfortunately. So Medicare Advantage is a much more narrow product
Now,
line.
certain individuals, depending on their pre-existing stuff, can't qualify
No.
for F, correct?
There, again, not all companies will ask questions. If you're just turning 65, they can ask questions. It's guaranteed issue. After that, some companies ask medical questions, not every company does. Okay? Blue Cross, currently in Illinois, is guaranteed issue no matter what age, no matter what conditions you have. Okay? But they're the only carrier that I'm aware of right now that does that. Okay? Thank you, ladies.
So
Right.
someone would have to cover you, but it just depends on how bad you are, if you would pay more.
You could, yeah, in some cases you could pay more for it, okay? But again,
Somebody has to
yeah.
take you.
in Blue Cross's case, okay, their pricing isn't bad and they can't surcharge or anything. Okay? So it's an option.
I think it's good to go locally if you can, because you'll have questions.
Well, yeah, there are,
I mean, you know, if you know someone or
Yeah.
you're currently involved, it's
Absolutely.
a lot easier.
and there are qualified insurance agents in the area, okay? You know, I can only do education. I can't do the specifics. So reach out to Mike, reach out to the hospital here. Aaron would help, and we can do things from there. All right. Other questions? Thank you. You've been wonderful. I appreciate your time.